Hey, it's Jeff from AYC TV. All right, so we're going to keep moving on with these orthopedic tests that I have to do for school, but I think it is nice to put these online so you can see it. Now, caveat to this, I'm learning, I'm a student, so these tests aren't 100% of what I'm showing you. You should go to a licensed medical professional if you actually want to have these things diagnosed, okay? So this is just me learning, but at the same time, we can all be learning together about what's happening in the body and how the medical profession is actually going to test and show you how this stuff works, all right? So here's the knee. So what I want to do, I want to start with observing the knee. Just look and see if there's any swelling around the knee in that soft tissue. I just want to start to look at the tibial tuberosity. So it's this little bump right here on the tibial bone, and that's where the patellar ligament is going to attach to, right? So I also want to be looking at the patella position. Where is that kneecap? Is it shifted off to the outside, the inside, medial, or lateral? Then I'm going to look at the whole leg in itself. So is there a valgus, which is going to be knock-kneed this way, or is there a varus, which is going to be bow-legged like that, so kicked out? So I want to look in that. The other thing I want to watch is the range of motion. So having the patient bend the knee and extend the knee, right? And to see what happens and how the depths that they can go. Can they fully extend? Can they fully flex? Okay. So then I'm going to palpate. After I've looked at everything, I'm going to go in and I'm going to start to touch. So I'm going to go along the joint line, right, between the femur and the tibia. I'm going to go around that joint line and just feel for tenderness and go around. Then after that, I'm going to check the patellar tendon, right? So here we go. I'm just going to go back and forth below the patella, above the patella, and just check and see if that's intact, okay? Then I'm going to check the pes anserine. Where that is on the tibial bone on the medial side, middle side, right here. You have a bunch of muscular and ligamental attachment points to this, so it can be a little bit tender, right? So you want to palpate that and see if it is tender. That's just something to know. All right, and then after we've done all the palpation, then we want to start to test the tissue. The first test I'm going to do is start to look at the ACL, the anterior cruciate ligament. So I'm going to do what's called the Lachman's test. So it's taking the patient's leg out to the side. I'm going to support their foot with my knees here. This left hand goes on top of the femur. The right hand goes on the inside of the tibial bone. I'm going to support the femur. I'm going to pull the tibial bone towards me, challenging that ACL, okay? Then we can do what's called the pivot shift test, right? So what I'm going to do, I'm going to take the leg here. I'm going to medially rotate the foot. So I'm going to turn that in and then create a valgus stretch. I'm going to push in from lateral to medial, pushing in. Now from here I'm going to start to flex the knee. Now if the ACL ligament is off, then the tibial bone will start to pop up. It will dislocate like that, turn. And then by the time I get a little bit further up, that IT band will pull it right back down in place, and then that's how I know that that's that ACL, right? Okay, so that is the pivot shift. Then the lever test, we're going to take the fist, and it goes underneath the calf here, and we push down on the femur. And that foot should lift up like that, like a lever. If that ACL is not intact, then that foot won't lift up, so it's a positive sign. Anterior drawer test. I'm going to take the patient's knee, I'm going to bend it, I'm going to sit on the foot, they're supported, and then I'm going to take and start to pull the tibia towards me, so anterior drawer. I have to support it just because he's going to fall off this if I don't. But I would have both hands here, the patient's weight would hold it, and I would pull towards me, and it would look like this. That's the anterior drawer test right there, except I do both hands. The posterior drawer test is going to test for the PCL, the posterior cruciate ligament. And that's where I'm taking this tibial bone, and this time I'm pushing this way towards it. And so if that PCL was not intact, then it would slide, and that's what it would look like, okay? Now we have what's called the McMurray's test. So the McMurray's test, we're testing out the meniscus. So what I'm going to do is I'm going to have the knee bent, flexed up here. Then I'm going to create an external rotation and a varus stretch. So I'm going to push from medial to lateral, so pushes out. And then once I have that, I'm going to start to take that leg into extension, and that's testing the medial meniscus, okay? Now, to the lateral meniscus, so I'm up here, same spot. This time I'm going to create an internal rotation and a valgus stretch, in and then extend. So you can see as I'm pushing this way, it's going to create that compression here on that lateral meniscus. So we turn, we push, and then extend. And if that caused pain, then that would be a positive sign into a lateral meniscus issue. Okay? So that's the meniscus down here. There's another test called the Thessaly's test. This one I'm not really too keen on. So you hold the patient's hands, they bend one knee, they stand on one leg, and then they move the knee back and forth. Well, I think if you have an issue with the meniscus, that's just going to chew it up. So I'm not a big fan of that test, but it is part of this whole thing, so I have to do it anyway. All right, so then once I have that, then we want to test the collaterals, right? So the lateral collateral ligament and the medial collateral ligament. So we do this with the valgus and the varus stretch. So the valgus stretch is I'm going to hold the tibial bone, and then I'm going to press from lateral to medial in, and I'm going to test that medial collateral ligament. For the varus test, I'm going to hold the tibial bone, I go from medial to lateral and push out, and I'm going to test that lateral collateral ligament, LCL, right out here, okay? All right, then we do what's called the patellar inhibition test. So I'm going to take the patella, I'm going to push down towards the knee, and then I have the patient contract the quadricep or try to lift the kneecap up this way. And if it feels grindy or something like that, then we know there's an issue in the patella. The patellar apprehension test, I can take the kneecap and push it out to the side and pull it in towards the side. So lateral and medial. And if they don't like that, if they're like pain or something like that, then you know that's indicative of something's going on there. Then we have what's called the patellar tap, where we gather up the tissue around it and then tap. And this is looking for fluid onto the knees, all right? Now we have one last thing here, and this is called the Nobel's test, and this is for the IT band. So this lateral epicondyle of the femur right here, I'm going to stick my thumb and push into it, just like that. Your IT band is going to be running all the way down into this space here, and I'm going to trap it. Now once I've trapped it, I'm going to start to bend the knee, and if there's pain, as I'm pushing through that, then you know that there's going to be some issue into that IT band. All right, so that is orthopedics on the knee right there at a student level, and I hope this helps.